Every day, 35 Australian women are diagnosed with breast cancer. It's an alarmingly high statistic. But the good news is that most of these women survive, thanks to the treatments that are now available and the resilience of the human spirit. This is the story of 3 women and their journey with breast cancer: Debbie, Sandra and Marta. Each is at a different stage of her treatment.
You just think about death and, oh my gosh, how's Greg, my husband, going to survive without, bringing up 2 boys and run his own business, and what's going to happen to the kids, and, all those sort of thoughts.
I thought it was a death sentence, I really did. You hear that terrible C word and you panic. But I feel that the doctors and the nurses and everyone has made me realise that there is hope out there.
A lot of people die for breast cancer, but a lot of people survive from breast cancer. And I will be a survivor.
Marta and her husband Nelson moved from Uruguay to Australia over 30 years ago. She'd been looking forward to spending more time with Nelson, with her daughter Marina and with her close friends. But 1 year after retiring from her office job, Marta was diagnosed with breast cancer. We met her just after she'd received the news.
10 years ago, I did my first mammogram. And after that, every 2 years I have a reminder, and I've been doing really 5 times. And this time, 2 weeks ago, I have the results of the last one, because they found in the ultrasound something was not clear. They had to do a biopsy on it, and I wait for a little while, and after the doctor seen me, called me and tell me there was no very good news, because they found some cells and that there are malignant cells. That means I have cancer. Esticas, como un tipo de estica, ¿viste que
yeah, the sticker, you know
you say,
in black.
Yeah. Sí, ahora.
Marta had been disturbed to find that her last routine mammogram had shown a malignant cancer. She was referred to the New South Wales Breast Cancer Institute in Sydney for treatment, which commences with a series of consultations with her surgeon, Associate Professor Owen Ung. Today, Marta's come to meet Professor Ung to talk through and decide on a treatment plan.
Hi, Marta. Okay, well, we've had a good talk about things at our meeting.
Yeah.
A bit higher. Certainly we think that you're suitable for breast conserving surgery, if that's your choice. I'm going to go through the options with you, okay? I'll just draw on the back of this bit of paper here. There's a number of issues in deciding how to treat this. Well, Marta had no symptoms, but was referred to the New South Wales Breast Cancer Institute after having a screening mammogram which detected a very small breast cancer in the breast. We discussed with her a number of options of treatment. Usually for something as small as this, we'd recommend a wide excision. Some people call this a lumpectomy, but it's much more than just a small lump being taken out. Think of the lump as being like the yolk in the middle of an egg, and I always explain to patients that this yolk needs to be intact. If it's spilling to the edges or broken, then sometimes we need to come back and do more surgery. So if we go for the lumpectomy option, then there's always that risk that we might need to come back for more surgery. Normally in these situations, when we're dealing with small screen-detected cancers, we get a clearance with the first operation.
The news is good, but is still slightly unsettling. Although she still has many questions, Marta decides that she wants to try and stay positive.
I feel better in one way because he reassured
Yeah, he seems like he's confident that
And
everything
he's
will be
confident,
okay.
and he's a very good doctor too. His prognosis is good. I mean,
Yeah.
yeah.
Whilst this is a very small cancer, in fact, finding it and removing it is far more complex. First of all, the radiologist has to re-examine all the previous imaging, that's the mammogram and the ultrasound scan, and work out where this tiny tumour is. Fortunately, in Marta's case, you can also see this small tumour on an ultrasound scan. So the ultrasound scan is going to be used as a way to locate it. What the radiologist has to do is insert a very fine wire. It's a skinny little wire, like a bit of fuse wire with a hook on it, and that's inserted into the breast under local anaesthetic, and that'll stay in place so that when Marta goes to the operating theatre, the surgeon will be able to locate the tumour. Now, after the wire's put in, we normally do a mammogram as well, so that the surgeon can visualise where that wire is within the breast.
After she has the wire inserted, Marta walks down the corridor to have another mammogram. Exhausted, but still determined to remain positive, Marta prepares herself for the operation.
When Marta came to surgery, I was able to follow the wire down that had been inserted by the radiologist and take out the abnormality at the end of the wire. I remove a piece of tissue about the size of a golf ball, which is enough to give us a margin around the tumour, but not cause a cosmetic defect. After the tumour's been removed, we then perform the sentinel node biopsy. Think of the sentinel node as like Central Station. Every train has to pass through it. So if we know what's happening in the sentinel node, we can make a bit of a prediction about what might be happening with the other lymph glands. Now that tissue, which is a lymph node, is sent off to pathology and tested while Marta's still asleep on the table. In Marta's case, the sentinel node came back clear, so we didn't proceed on and remove any other lymph glands.
Each patient treated by the BCI has a team of professionals looking after them. The specialists meet weekly to examine the treatment plans and progress of their patients. Plans are then discussed with the patient, who can accept or reject the treatment options provided. This partnership approach between specialists and between specialist and patient ensures that each patient has a well-researched, individualised treatment plan.
Working as a team is really important. You bring different experts, a surgeon who operates, a radiation oncologist like myself who gives radiation treatment, and a chemotherapy doctor, that's a medical oncologist who gives the chemotherapy. But it's really important that we support the patient, work out the timing of these treatments, and discuss with the patient different perspectives from our own discipline, as well as each other's disciplines.
1 week later, Marta returned to the BCI to receive the pathology results of her lumpectomy, which have been discussed by the BCI team. It's been a tense time for her.
I'm okay, but I feel anxious. I want to know as soon as possible what is the result and what is the next step, the one I have to do. After that, we'll be all right. Just the waiting really is the worst thing.
The return visit is a very difficult time for both patient and doctor, and obviously in Marta's case I understood that she was going to be very anxious about what the results might show. It's important at this time to get the information across so that it's understandable, particularly if there's going to be some bad news there. But at the same time, to offer hope. And in Marta's case, there was some very good news. Her lymph node was clear, which meant that she didn't need to have any more surgery to the armpit. Unfortunately, the margin wasn't clear, and that meant that we were going to have to discuss more surgery. I'll go through the results with you now. We've had our team meeting.
Yes, that's I'm anxious about.
Look, I've got a mixture of news for you, Marta. It's mostly good.
All right.
It's mostly good news. But there's a few little things we're going to need to attend to.
All right.
The tumour itself was small. The final measurement by the pathologist was 12 millimetres, which was what we thought it was going to be on the X-rays beforehand, and it was very small. And the sentinel node, which remember we told you that we were going to do the imprints.
Yes.
The test we did while you were asleep on the table was negative, and we've finally confirmed that this week, so that your sentinel node is clear, which means that your lymph nodes are clear and we don't need to do any more surgery to your lymph nodes.
Okay.
That left us with three options. One option was to do nothing, but that wasn't something that I would recommend to Marta. The second option was to take a further margin around the tumour, and that would be another operation, but not a large operation, a small operation. And the third option would be to have a mastectomy, and that would guarantee that the tumour was clear, but might be more surgery than what she actually needs to get clear of the tumour. So after a good discussion about the options, Marta was very comfortable with the second option, and that was to go back and try to get a further margin around the tumour. I can't guarantee you yet that we're clear until we actually do the next
I have to wait. And then that is what you recommend, the last option, to have taken more sample of the tissues around. That is your recommendation?
I would recommend that, because we've had a look at your pathology and it all looks pretty well clear except for one tiny little dot. But it is worthwhile doing this one more procedure, I think, in your case.
All right. Okay.
And that's not a big operation. It's just day surgery, coming back for a day in hospital next week, and we'll take a little bit more. Yeah.
All right.
Discussing test results and treatment can be very unsettling at this time, and even though there were many questions still to be answered, Marta chose to remain positive throughout this. It's always difficult breaking bad news, and you have to mentally prepare yourself for that as well. The way to get through it, of course, is to stress the positives, and there's always positives in every situation.
Debbie was only 33 when she was diagnosed with breast cancer. As is the case for many young mothers, Debbie's busy life means not only maintaining a household, but also helping her husband Greg, who runs his own business. Up until the time of diagnosis, Debbie also worked as a preschool teacher. Unlike Marta, there is a history of breast cancer in Debbie's family.
Well, I first found the lump 2 days after I had my baby. I had a really bad back when I was pregnant, and I breastfed for the first 2 days, and then my back was really bad, so I stopped breastfeeding. But I found the lump because when you're breastfeeding, your breasts are lumpy and you have to massage the lumps out. And I remember thinking at the time, I hope I don't get I couldn't massage this particular lump out. I remember thinking, I hope I don't get mastitis, And then I stopped breastfeeding and forgot all about it. I had my baby, came home and everything like that, and he was, I think, about 6 weeks old. And I was lying in bed one night and I rolled over onto my stomach and I thought, it's a little bit sore. And then I felt straight away when I felt it. It was, 4 by 3 centimetres, so it was a big lump. And that night, I just knew, as soon as I felt it, I knew it was cancer. I just had a gut feeling. The first night I found the lump, I didn't sleep an ounce. I was on the internet all night looking up statistics and things like that.
Debbie went to her local doctor. At first, the results of the test were clear but inconclusive. However, she eventually received confirmation of breast cancer from Professor Ung. Helping her family cope with the news was her next step.
I never thought it would be breast cancer. I was telling her that, it's just, it'll be a cyst, or it's just something benign, something minor.
Because everyone around me, my husband included, thought it was going to be fine because the first lot of results came back clear, but I knew it was going to be cancer. And yes, I was by myself and Professor Ung told me, but I sort of by that stage I was prepared for it. I wasn't shocked or, and I wasn't, not that I wasn't upset, but I'd sort of dealt with a lot of those feelings when I first found the lump because I knew then that it was cancer. So I went in and had the lumpectomy, had the lump removed, had all the lymph nodes from under my left arm removed. And that took then I think another 3 or 4 days before you get all the pathology back, which is excruciating wait because you have to see whether or not it spread to the lymph nodes, and it had spread to 9 under my arm and 1 in the centre here, which then meant that I had to have 18 weeks chemotherapy, and that was 6 cycles, so I had it once every 3 weeks, and that was the one where my hair fell out and the nausea, the really harsh one. And after that, I had a little bit of week or two's break, and then I had 6 weeks radiation, followed by another short break, week or two break, and then 12 weeks chemotherapy, and that was once a week for 12 weeks.
Debbie's treatment plan lasted for a year. It involved constant trips to hospital, and much of her time at home in between treatments was spent recuperating. Debbie was lucky in that she had the full support of family and friends who helped with moral support and running the household. However, it wasn't always easy on them either.
You also felt very helpless, actually, because you weren't the one going through it. You could only sort of, watch and try and, offer your support, but, at times you did feel a bit helpless.
What would happen was she would get better. She'd have the chemo and have a terrible week and a half, and then by the third week she would be feeling okay. She'd be near back to not normal, but she would be feeling okay and able to go out and everything, and then bang, she'd have the chemo again, and it'd be the same thing over and over, and it was just hard to see her constantly, having to go through that and be that sick. Even though it's a good thing and it's doing something to help fight the cancer, it's still difficult to watch someone you love go through that.
For Debbie, the harshest treatment was the chemotherapy.
These days, maybe 30 or 40% of women take on chemotherapy because it gives a slight benefit in survival. And that benefit might be from 2 to 3%, but as high as 10%. So really important to look at chemotherapy.
The first lot of chemotherapy I had was called AC, and that was going once every 3 weeks. I had mine done at Westmead Private, which was fantastic. The nurses there were absolutely brilliant. And it took about 2.5 hours. It sort of involved a recliner like this. You'd sit back in your recline and they'd come along, and it was quite scary the first time actually. They set me up, they put the saline drip in and everything like that, and that was okay. And then the nurse went off and she came back and she had the full mask on, the gown, the gloves, the works. And I said, oh my God, what are you dressed like that for? And she said, because we're around it all the time and it's so toxic, we have to be dressed like this for safety. And it really made me realise how, I thought, oh my God, they're putting that toxic stuff through my body. And it was hard too because I didn't have any symptoms. I had the lump, but that was it. I wasn't feeling sick. I wasn't feeling lethargic. I had I was feeling quite good. I'd given birth. My baby was 6 weeks old. So it was hard having them put this drug through my body, this toxic drug, and then to feel so horrible with the nausea and everything when I hadn't felt sick in the first place. That was difficult. And it was also difficult by about, I think, the 3rd week of chemo. That's when your hair is supposed to fall out. I had really long hair and had for years, and it was sort of a part of me. I just, and having every night I would have nightmares about it falling out. I'd picture myself getting out of bed and, because when it falls out, big clumps come out. So I was picturing myself waking up with a big clump of hair on the pillow and having to take my 4-year-old to preschool with it like that. So eventually I said to my husband, I just couldn't stand it anymore. So before it actually even started coming out, I said to my husband, I can't stand it. So he let me shave his head and then he shaved mine at home.
She looked a damn sight better than what I did with the shaved head. I had very rough panel beating.
It sort of gave me a little bit of control. I felt better about it, even though, I didn't look very attractive or anything like that. But it was just, my way of coping with that.
Although many of the short-term effects of breast cancer treatment can be difficult to handle, Debbie found positive long-term effects that she didn't expect.
Yeah, emotionally, it has had a huge impact on my life. Before this, I guess I was sort of just coasting along in life, but I actually said to my husband the other day, as long as this doesn't kill me, I'm glad I've had it, because I think I'm a much better person, I'm more confident. Having the boys has really kept me going. Whenever I'm down, I just think about them and I think, no, I'm not going to do it. And any time I have a negative thought, I just put it straight out. I actually say, no, I'm not going to think like that, and I put it out of my head. You know, and also too, little things now don't stress me like they used to, because I think, well, life's too short, you know. And it has had a huge impact, I think, on my family. Some members more than others. I think Greg, my husband, it's had a positive effect on him as far as the same sort of things. We realise now that, you know, those little things we used to argue about are just silly and we don't bother anymore. And we also too make sure whenever he has a day off or anything like that, we, you know, take the kids to the zoo, or we go to the beach, or, you know, we're doing stuff all the time. We're having good family time together, because you realise that life is short. And my sister Donna, I think it's had and her husband Andrew, it's particularly had an impact on them. I know my sister is a lot more easygoing now. She's just, yeah, again, it just, things that used to get you angry or stressed, you just don't worry about anymore, because you think, well, there's, you know, much more to life than worrying about that.
It's definitely brought us closer together, and yeah, made me realise what's important in life, and we're just having a great time.
When we met Sandra, she was nearing the end of her first chemotherapy treatment plan. Her cancer had progressed further than Marta's and Debbie's, and as a result, it had been necessary for her to have a mastectomy. Sandra is a single mum with 3 children, and like Debbie, she has stopped working during her breast cancer treatment.
I've always done regular breast tests, self-examinations on my breast, and never discovered anything there. And then one day I was doing it and I just felt a very small lump, and I just thought, my goodness, what's this? I better go, because of my age, and I hadn't had my scans done. And it was the most scariest thing I've ever been through in my life, because you just don't understand what you have to go through, all the tests and all the doctor's appointments. You just don't know what's ahead of you, and it's just very, very scary. But I think if you focus on just living day to day, not worrying about what's going to happen tomorrow, I think it does help you cope with everything.
Sandra also found that sharing with a family member helped her cope, especially through the difficult period of initial diagnosis.
Just 1 week of just full-on stress and worrying, you know, what was going to happen. Was it malignant? Was it benign? I didn't know. The only person I told at that point was my daughter, because I didn't want to worry the rest of the family, and I knew she was strong enough to cope with it. So she came along to all my appointments.
They said it'd been there for like 2-3 years and she hadn't noticed. And they said that they don't think they can just remove the lump, they think they have to remove the whole breast. I was like, oh my God, such a shock. You don't expect to hear that. You always go into every doctor's appointment thinking, oh, it's not going to be that bad, it's going to be okay, it's going to be okay. But the bad news comes, and then more bad news comes.
I thought, well, if this is what's going to happen in my life, I have to cope with it. And from that day I focused on what would be ahead of me. I took the results back to my local doctor, and then he confirmed that I did have breast cancer.
In Sandra's case, unfortunately, mastectomy was really the only option. What determines whether we can do breast-conserving surgery or in fact need to do a mastectomy really is the size of the tumour in relationship to the size of the breast. So if a woman has a very large tumour, then taking a wide margin around that is not going to leave much tissue, and so that woman is better off having a mastectomy.
I mean, I thought it was a death sentence, I really did. You hear that terrible C word and you panic. But I feel that the doctors and the nurses and everyone has made me realise that there is hope out there.
After her mastectomy, Sandra began a series of chemotherapy treatments at Blacktown Hospital's oncology unit.
Chemotherapy is is an important form of anti-cancer therapy. We give an injection of this drug into the vein, and it treats the whole body. That's the advantage of it. It works against dividing cells such as the cancer cell. The side effect is that it works against other dividing cells such as our hair, our bone marrow, and perhaps the lining inside our mouth. But our normal cells have got all the defence mechanisms to make them recover again. The cancer cell, because it's abnormal, doesn't have all our protection mechanisms and then dies off.
The women at Blacktown are absolutely wonderful. They're very supportive. They talk you through everything that's happening to you. They explain how chemo will make you feel, but until you have chemo, you don't realise how it makes your body feel.
You're no more enjoying food for a couple of weeks.
When they put the drip in, I can honestly feel that chemo going through my body. It's just an unbelievable feeling. The taste, you can taste it for about 3 weeks. You just get over having a taste on your lips before you have to go back for the next treatment. You have a lot of problems, your appetite sort of comes and goes. The taste of water just makes me feel bilious.
Chemotherapy treats the whole body. It's a type of insurance therapy, but it does have some side effects. It can make you lose all your hair, but it does grow back. It can cause tiredness. It can cause some mouth ulcers. It can sometimes cause some weight gain. And the other problem is sometimes early menopause. But I have some patients who go right through the chemotherapy with no side effects at all, apart from losing their hair. But the hair always comes back.
One of the other side effects of chemo is mood swings. Oh my goodness, my poor family, I don't know how they cope with me. I have days where I'm as happy as anything, and other days where I just snap and snarl. I don't have to look at me sideways, and it's like I'm like a big angry bear ready to attack them, you know, and I honestly don't know how they cope, but they have done. My daughter, the one that's been there for me, she just tells me as it is. If I start yelling and screaming, she yells and screams back and just says, "Mum, come on, you're not realising you're doing it," and you don't.
You know, we clash at the best of times, but 1 minute she'll be happy, the next minute she'll be angry at you for just saying hello in the wrong tone of voice, you know what I mean? That's been very stressful. It's like, you just don't know what mood she's going to be in when you walk in the door. You don't know how she's going to react to anything you do. It's, you know, just waiting for a bomb to explode sometimes.
Through long days and nights, Sandra thought often about her breast cancer and how she would cope.
I realised once I spoke to the doctors that there was hope, and the survival rate of breast cancer is higher than it's ever been, because the doctors told me to focus and not think about anything else, forget about everything, and just focus on yourself. For once in your life, you focus on what's happening in your body. You have to be positive, because the survival rate is just so high now to what it was a few years ago, and every day they're hopefully getting closer to a cure for breast cancer. Admittedly, I have bad days. My bad days overwhelm me sometimes. They make me feel like I'm alone. But once you go to the Breast Institute and you see all these women and men sitting there, you realise that you're just one of thousands of women and men that have breast cancer.
For many women like Sandra, lifestyle changes often occur while they're undergoing treatment.
I got worried because she was a very independent person, very strong person. She never asked anyone for anything and never relied on anyone. She always supported her family by herself. And it's just been hard for her now, being home and probably adjusting to a lower income also too. That's hard, and medications. And I'm just always feel sorry for her and wish I could do something more for her to help her.
How are you feeling today? Feel alright? A bit tired, but apart from that, I'm alright. Still got that rotten sinus, it's killing me. Yeah. But they're right, they told me after the last chemo I'd be absolutely zapped, and that's how I'm feeling, just dead. Just tired, I'm just tired all the time. All I want to do is sleep.
She feels like she's been robbed, I suppose, I don't know. It's different in her hair. She used to have beautiful long hair, and now she's got no hair, so it's been very hard for her to adjust, but we sort of joke around about it, and then everything's fine. But I can't tell you how she's feeling deep inside. It's just, that's something that she's feeling. But to me, she never changes. She's always Sandra. Even if she puts a good face on, so she's always bubbly.
Marta had been relieved that she hadn't had to have chemotherapy, but she is going to have radiotherapy. Today, she's come back to the Breast Cancer Institute to meet with Professor John Boyages to find out what's involved.
Good morning. Good morning.
Radiation oncologist.
Nice to
John
meet you.
Boyages. Hello.
Hi, how are you?
How are you?
Very nice to meet you.
Hello.
Yeah.
Your daughter?
Yes.
Yep. Good. Okay. So, the way I like to just explain it to you is your breast is like a rose.
Yeah.
Do you garden?
Yes.
Do you garden? Okay. Now, there's a little weed under the rose, okay? And Professor Ryan's going to get his little spade and come in.
Pull it out.
And just pull it out like that, okay? So what happens then? The rose is still there, which is your breast, but the garden looks perfectly clear. Okay, the sand looks nice.
Yes.
And that's in the same garden bed. Now, I'm a bit like a weed mat, okay?
Yes.
That's what the radiotherapy does. I come along and put a weed mat down
To prevent.
to starve anything left behind. So if there's a little seed left behind,
You kill it.
then we try and starve it. For Marta, we gave radiotherapy to the whole breast, but the really important thing is that we get a healthy margin around the cancer. Now in Marta, it went to one of the edges, so unfortunately we had to take her back and do more surgery. The good news was the second margins were clear, and we then gave a course of radiotherapy. Radiotherapy involves setting up a patient in a radiotherapy simulator. The simulator is like a simulator in an aeroplane. It's not the real thing, but we take all our measurements because every patient's shape and size is different. And we use a whole lot of scary lights and laser beams and measurements to get as accurate a perspective of the patient's breast and body shape as possible. We then put that through a radiotherapy planning computer. We acquire information from a CAT scanner and work out the best directions of beams, the appropriate dose and so on. After all that is done, it takes about a week of back office calculations and physics checks and double checks and triple checks. We ask the patient to come in for their first treatment. The first treatment can be a really difficult time. It's scary going into this strange room with really thick walls, but the patients are always watched by an X-ray monitor unit outside by trained staff and also by a microphone so we can hear what they're saying. The radiation treatment is just like having an X-ray. You don't feel it, and it only takes about a minute.
Well, this is Mrs. Nunes' plan, and we've managed to get the dose off the heart, as you can see there, so 10 grades running along there. Got 50 grade completely covering the breast, more or less. So that's all the central axis slices. This is where the maximum is.
So what's the maximum?
55 grade, which is as happening on the outer side of the breast, which is ideal.
You happy with that?
Yep, that's good.
After treatment, the patients occasionally, after week 1 or 2, can be a little bit tired, but in general, by week 3, they may start getting a little bit of sunburn.
I didn't have any side effects. In the first treatment, they said probably one of the things could be happen is a redness on the skin, and but I didn't have that. I don't have that.
Radiotherapy, we found back in the 1800s that treating cancer with high-dose X-rays in fact kills the cancer cells, and it works right at the DNA level of that cancer cell. Because the cancer cell isn't normal, the radiotherapy knocks that cell out, whereas our normal cells, such as the skin, can recover because we've got recovery mechanisms in our body. So high-dose radiotherapy can kill cancer cells, and the normal cells can once again recover.
I didn't think I got to die. I thought I got to survive, and I had to put all my effort in to overcome the problem. You see, and that is what happened. I think that is what gave me energy to continue doing things. Really, I don't want to. I never want to think about the bad things. I look the positive and try to go there, and that is got me through.
In addition to the support from her medical team and her family and friends, Marta's attitude helped her get through the treatment.
Whatever happened, I should continue my life the way it is, and it's not the end of the road. Just it's a stone on the road.
While Marta looks to the future, Debbie is about to find out whether she carries a mutation of a breast cancer gene that may mean she might require further surgery.
Unfortunately, breast cancer in our community is common, and so very many women will have a family history of breast cancer just by chance. Only some women will have a very strong family history with generation after generation of women affected. The way in which we do genetic testing is that we take blood, and from the white blood cells we extract the DNA. And we really hone down on the genes that we're interested in. There's 30,000 different genes, but we're really just testing 2 genes, BRCA1 and BRCA2. And we have several methods whereby we look at the sequence, the code in those genes. But these are big genes, they're difficult to test, and that sort of sequencing takes a long time.
I've just been waiting for this appointment. As it got closer, I've sort of becoming a bit more nervous because it's taken a year to get the results, so I haven't really been thinking about it. I've had lots of other things to think about, but since I found out about the appointment, I'm sort of a bit anxious now just to know either way.
Today, she and Greg have come to meet geneticist Associate Professor Judy Kirk, who has studied Debbie's family history.
We took blood for genetic testing about a year ago, and what we were trying to do is try and find the gene fault that causes the problem for this family. Now, we haven't found anything in those genes yet, and that's the bottom line, I guess. That's what I'm going to tell you today. But I'll also explain to you that that's not a very helpful result in a way. So we looked at the family history and we thought, well, how likely is it that there is a faulty gene causing the problem? If we're looking for a fault that's causing the problem in the family, we take blood from someone who we think might have that genetic fault. So we know that even in women with the strongest family histories, sometimes we don't find any genetic fault. I can't say, Debbie, you don't have one of these genetic faults. I'm still a little bit worried about this family history. And it remains possible that you might have one of these genetic faults, and we'll keep searching.
It's hard. I mean, it's not like I'm all clear and that's it, I'm happy. And I mean, I was sort of thinking if I did have the gene, that's it, I was having my breasts off and that was a definite. So it's nice not to have that done. But yeah, again, it's sort of, like she said, it's inconclusive. It's up in the air. So I don't know how to feel actually.
The results leave Debbie perplexed.
If we eventually find that Debbie has one of these gene mutations, then we will have the opportunity of doing predictive genetic testing for her sisters who are at risk of carrying this same mutation. There's a 50-50 risk for each of them that they have the gene fault, if there's a gene fault in this family. And the predictive testing would give them a very clear idea of, yes, they've got the gene fault, they are at high risk, they need certain screening and prevention, or no, they have not got this gene fault, they're at the average risk for breast cancer, they need the usual form of screening, and importantly, if they don't have that gene fault, they can't pass it on to their children. So there's very valuable information for a lot of family members once we've made the step of identifying a genetic fault within a family.
Debbie is now moving on to focus on preventative measures.
Well, realistically, because my the cancer had gone to some of my lymph nodes, there is a reasonably strong chance that it could come back. But what I'm doing now is everything I can to prevent it from coming back. I'm exercising. I'm on tamoxifen, a drug that I'll take for 5 years, and that decreases the chance of it coming back. And also I'm trying to eat more organic things, healthier, and I'm just now trying to make the most of every day, And again, I'll try, whenever I have, occasionally I'll have those fears that it might come back, and I just think, no, I'm not going to think like that, because, it might come back in a year, it might come back in 10 years, or it might never come back. So I just want to get on with my life and just sort of deal with it that way, because it's just, life's too short to be worrying about it every day. we had a fundraising ball on Saturday night, and that was my husband actually organised that, and it sort of started while I was having treatment. Greg said to me, "Oh, we're going to have a party when you finish," and I said, "Oh, that's a great idea. I'd like that." And then and it's sort of after another week or so, he said, "Oh, maybe we should make it like a little fundraiser, you know, with it." And I'm thinking with close family and friends. I thought, oh, okay, that's a good idea.
It started off as just an idea of having a bit of a, you know, party with some good friends, and it grew into the massive event that it was, with 280 people at the Epping Club.
And I guess I wouldn't be here tonight if it wasn't for my team of doctors down here, Professor Owen Ung, Professor John Burgess and Professor Rick Kefford. Not only did they save my life, but they've also been both compassionate and understanding along the way, so thank you. It became a 300 people fundraiser here in the Grand Ballroom, so that's how it all started.
Amazing is probably the best word I can use. It's just overwhelming to see the amount of support, you know, that we've been given to this, and we're just so happy that it's all going towards such a great cause.
Yeah. We had everyone there who'd been helpful, who'd, you know, cooked us dinners or looked after the kids and things like that. And it was just a good way to sort of celebrate all of that, to thank them and to raise money for such a great institute as well.
Debbie's year of treatment for breast cancer has finished on a high note, one that Sandra hopes to share. In the meantime, Sandra will continue with chemo and possibly other therapies, and has started breast inflation treatment in preparation for a breast implant.
I had a male friend which I was seeing for 2 years. He doesn't even know I've got breast cancer. I couldn't bring myself to tell him. I just walked away from the relationship because I just felt I couldn't be a complete woman. When I first found out I had breast cancer, I felt that who would want someone with a breast off, you know. I wasn't going to have it done, but my daughter talked me into it because she said, "Mum, you're still relatively young, and why go through life with one breast when you don't have to?" And that's why I decided to have the implant put in.
Basically, Sandra comes back every so often, roughly about 2 weeks, maybe 3 weeks if they're on chemotherapy, and we put some fluid in the tissue expander and to fill it up so that it stretches the skin out a little bit each time. And then usually it only takes about 4 or 6 times, and we achieve what we want to achieve. And then they complete whatever therapy that they have, like chemo, and then in some instances radiotherapy. And then once they recover fully, then we come back and take the expander out and put the implant in.
Sandra had a total of 4 inflations, and that's where we put normal saline or salt water to inflate the breast implant or the prosthesis. Once she reached a maximum size, we were then able to give the radiotherapy. After the radiotherapy, we started on an anti-hormone drug called tamoxifen, which also works against the cancer cells. And we're hoping that she is now on her road to recovery, and hopefully with a good prognosis.
Marta, on the other hand, is celebrating with a round-the-world holiday with her husband Nelson. This dream holiday was in the planning stages when Marta was diagnosed with breast cancer 9 months earlier.
Where we go to start the big tour to do Spain, Portugal, and we go across to Morocco. And I'm very excited about that part of the way, really.
The reality today is that most people beat breast cancer, and when we look at statistics over the last 30 years in this country, in Australia, we've seen marked improvements in cure rates, and the mortality rates from breast cancer have been on the way down. A recent study in the New England Journal of Medicine found that half of that improvement was due to early detection, and the other half was women having good radiotherapy, good surgery and good chemotherapy.
being able to look forward to the holiday was one of the key things that kept Marta going.